Hello, and welcome back to the My Sickle Cell Life podcast, hosted by yours truly, Janquisha Phillips. You are listening to Season 1, Episode 2 of the My Sickle Cell Life podcast. And in today's episode, we will be discussing the challenges that sickle cell warriors face with having sickle cell. So, in this episode, I will be diving into some of the challenges that I myself have faced and also some of the challenges that my fellow sickle cell warriors have faced. Um, Some of these warriors were very close to me, and some of them I have only met through a Facebook and the support groups that are online on the different social media apps. So, everyone has had challenges in their life. Um, we all go through something because we are all humans. And we know that to be a human is to have an imperfect life because we are imperfect beings. And so, therefore, challenges arrive in everyone's lives. And normally, the way that you handle challenges dictates how far you go in life. But with sickle cell, challenges and how we face them do not dictate whether we are going to live a long life with sickle cell or a short life with sickle cell. Because I know many, many warriors that faced every challenge diligently, they handled it gracefully, and they are no longer with us. And yes, how you face challenges will help you, especially in the recovering process. But one thing that is unique to sickle cell is no matter what you do, the sickle cells that are in your body are going to damage everything that it touches. And so, not only does sickle cell damage you internally, but it also creates extra challenges in your life that you were not prepared for. And even if you handle them gracefully, you can still end up checking out early. And so, of course, this is a pessimistic view on things. I like to think that I handle challenges pretty well. I've been through a lot um, outside of sickle cell and with sickle cell. I have been through a lot, and I'm still here. Only time will tell if the way that I've handled the challenges will help me or if it won't make a difference at all and I still end up checking out young. I pray that that isn't the case, but we'll see what happens. But anyway, so some of the challenges that I face with sickle cell, first is like we talked about in the first episode, pain. And I know, some people may say I'm beating a dead horse, especially people in my family, because they've heard it time and time again, how much pain I'm in. They're tired of hearing it. They don't want to hear anything else about my pain, okay? Um, but the pain is that severe. That's the thing. Just because I am a beautiful woman and I look like I'm 25 still, doesn't mean that I have not endured some excruciating pain. Now, yes, I have made it through every episode. I am still here to record this podcast, and I thank God for that. But the amount of downplaying of my pain just based on how I look in my life circumstances is astronomical, and it needs to stop. Okay? Now, I'm not going to make this whole episode about the pain again, but I do have to explain it just a little bit, and how outside of the physical that I feel, the mental is also hit with pain. And my relationships also are affected by this pain that I am feeling. My relationship with my children and my husband are affected by this pain. And so that is why it is number one on my list of challenges. When I was getting this all together, to prepare for the second episode, I made a list. And at the very top, which is where it will always remain, of course, pain is there. Okay? Pain has taken so many things from me, I cannot even begin to quantify in this episode how much it has stolen. Okay? It has stolen my youth. It has stolen my mind. It has stolen my spirit at times. It has stolen my body. It has wreaked havoc on my body, literally. It has stolen and cost me so many relationships, both professional and personal. It literally changed the trajectory of my life. Okay? This is the severity of the pain, and this is the severe impact that the pain has on me and on other sickle cell warriors and on our community. And the pain is so bad that they have literally started calling us addicts because we require so much pain medicine. They literally shame us for our pain, but they will never be able to grasp how it feels to have what feels like switchblades running through your veins. Now, if a switchblade cuts you on the finger, that shit's gonna hurt. If a switchblade cuts you anywhere, it's gonna hurt. So just imagine if there was a switchblade running through your veins. And if you can't imagine that, consider yourself blessed. Okay? So that is the number one challenge, because the pain has made me dependent on a medication that also has made my life even harder. Narcotic pain medication, and having to take it every single day, it's not a day at the beach. Like, I know that people think that we're running after the medication because we want to get high. But I promise you, I will run to the drug dealer's house to get high before I run to the doctor, okay? The drug dealer on the street can guarantee me that I will get high as a kite. Why would I ever waste my time going to the hospital if that's all I wanted? If all I wanted was to get high, I know about 10 different dope houses I can go into. Okay? So let's just be clear on that. Okay? But moving on from pain, the second thing that I have faced, or challenge I have faced, is parenting with a disability. That's a challenge of mine because parenting is already hard enough. But parenting with a disability just adds on that extra layer of thickness that I just love. I just love it because not only do I feel like I'm failing at life, but then I also feel like I'm failing at parenting. And if you talk to my sons, they will tell you I'm the best mom ever. They've told me many times I'm the best mom ever. And I love them. But even all the things that I've been able to carve out for them in this life is not enough. And I don't know if I'll ever be able to get over all of the things that sickle cell has robbed from me. All of the precious moments that I missed in my child's life or children's lives. Like, I've done things for them. And none of this stuff means anything to them. None of anything that I ever missed in their life is important to them. They don't care about that. But for me, when I keep a running score in my head of, just how good of a mom I may be, or the things that, you know, make me a not so great mom, sickle cell is right at the top of that because it limits me in a way that I could have never imagined. I was not prepared to be this limited. Okay? Because when I was dreaming of what I wanted to be when I grew up, it was all the things, the model, the actress, famous, a millionaire. These are all the things that I wanted. But I also wanted to be a mother. And I wanted to be the best at it. I wanted to be the best mom my kids could ever ask for. But sickle cell made sure to swoop in and muddy that all up for me, okay? Sickle cell has always been my enemy, and she lets me know that she does not take a back seat to anyone. Okay, she is undefeated. Okay, she is undefeated, and she will remind you that she's undefeated. Because just when you think that you have something all planned out, here comes sickle cell to say, hell no, we won't go. Hell no, we won't go. Hell no, we won't go. That's what she says every single time, you know, every single time. Now, yes, there are moments when I plan things and everything goes according to plan, and I thank God for that. I know that God had to do something. I know that God was in the midst of that thing to make sure that it could happen. So I don't take the good moments lightly at all. They mean the world to me because I've had so many bad moments. I've had so many canceled plans. I've had so many missed performances, missed award ceremonies, missed graduations. My son even got hurt while I was in the hospital. My son broke his arm. My youngest broke his arm, and I was in the hospital. I will never be able to forgive myself for not being there. I will never. Even though I know it's not my fault, I didn't ask for sickle cell. You know, when I volunteered to come to Earth, I didn't say, hey, I want an extra challenge when I get there. I didn't ask for that. But here I am. And I know that it's sickle cell. I know that I can blame sickle cell comfortably. No one will, say that it's my fault, right? No one in their right mind would blame me besides me. And that's all that matters. It even if everyone else did blame me, no amount of suffering that they could put me through is more suffering than I can put myself through. Okay, I beat myself up so much. Like to the point where I was late picking my son up the other day and I literally cried. I cried, y'all. That's how serious parenting is to me. That's how serious raising children is to me. That is how serious it is. I was sad. I was crying, bawling because I missed my son. I was late picking my son up. And that's the first time that's ever happened. Ever. Ever. I've never been that late. And it probably may never happen again, but it's the fact that it happened. And that's what this is like with sickle cell. That's what it's like. You can't plan too much because you get used to things going wrong when you do plan. You just have to do things spur of the moment sometimes because when you plan it out, it never goes according to plan. And sickle cell on top of that will make sure that it doesn't happen. Okay. And so the next challenge that I face is my sex life. Now, some may consider this a TMI moment, but this is my podcast. This is about my sickle cell life. So nothing is off limits at this point, okay? Not even my sex life. And, forgive me, babe, for talking about our sex life on this podcast, but people have to know the truth, okay? I still love you. But and I'm sure he would tell you, if he felt comfortable enough, he would tell you himself, we do not have enough sex anymore. And the biggest reason is because I'm always in pain. I'm always fatigued. I'm always going through something. And now there are moments, and we have ours. And, it's great. But my sex life is another challenge. because not only can sex trigger a crisis, but not having sex will trigger marital issues, you know? So it's like I have to juggle all of these things. I have to make sure that I am fulfilling, my marriage duties and making sure that my husband is fulfilled so that we can have a fulfilling marriage. But I also have to protect myself and make sure that I am not doing anything to cause myself a crisis that will land me in the hospital. And sometimes with sex, it's hard not to do that. It's hard not to be physical. So our sex life has taken a hit, and we're trying to navigate through it as best we can. We're trying to communicate through it. We're trying to figure it out. We're trying to get it together. But it is a challenge. And sickle cell does not add anything good to the party. And so, another challenge that we face is being what they call a frequent flyer in the hospital. When you go to the emergency room a lot, they have a name for you. They call you a frequent flyer, or they'll call you an addict, or they'll call you a drug seeker, you know, especially if you need pain medicine. You know, if you need pain medicine when you come to the ER, then they start to look at you crazy, even if they know that you have a debilitating disease that causes excruciating pain. Even if they know that, they're still going to look at you sideways. And they literally be looking at you as if you planned on coming to the ER, or as if you like coming. They really be looking at you like, why are you here? And I just be want to say, well, I'm not here because I want to be here. I would rather be anywhere else than fucking here. Okay? I would rather be anywhere else, but here the fuck I am. Okay? And I'm not happy about it either. So that makes two of us. And they I don't understand. I will never understand why people get into a profession and then get mad at the patients. If you're going to be a nurse, you cannot be asking people why they're in the ER. This is your job. It's your job to treat them when they get here the best that you can. It is not your job to judge them and ask them why they're here. And not because you want to help, but because you think they're here too much. Well, damn it, I think I'm here too much too. So, what are we going to do about it? Are y'all going to start coming to my house instead? Because that works for me. I'll take a little bit of home health if I can get it. But if I can't, then this is where I have to come. Because this is the place that they designated by law, that if you have a medical emergency, this is where you need to report. And damn it, I'm having a medical emergency, so I reported to where they told me to report to. Okay, that's it. But no, we get the frequent flyer labels, we get the drug seeker labels. We get the faker labels, we get the dramatic labels. There's literally TikToks of people, which I showed in the previous episode, of our dear healthcare workers saying that patients are dramatic. Patients are dramatic. Patients are drug seekers. You know, patients are frequent flyers. The very patients that they need to make money, they despise them and belittle them and clown them on the internet. And those nurses still get to keep their job. Those doctors still get to keep their jobs while they clown their patients and talk junk about their patients all over TikTok. But I digress. And so the next challenge is my kids are forced to grow up a lot faster than some kids. And I feel that way because they have to help me sometimes, you know, especially my oldest son. He's 13. And so he's had to step up a lot. He's had to grow up really fast. He's had to learn how to do things on his own, you know, at a lot younger age, because there are times when I am not able to do my normal duties and things still need to get done regardless. And what I mean by that is, like, if I am having a severe pain crisis and I cannot get out of the bed, well, my sons still need to eat. And so he has had to learn how to um, make his own food sometimes, you know, and not anything, super dangerous to where he's handling things that he's not old enough to handle, but still just doing the basic things like microwaving and using an air fryer and all of these different things, because when I'm not able, he still has to eat. He still has to, get up and get to school. And because he's the oldest, he also has to assist with his brother sometimes. And that makes me feel guilty as well. But I also remember when I was a lot younger, all the things that I was responsible for, you know, because my sister and I were being left home at 7 years old, you know? I've never done that to my sons, but that's the thing. They have had to learn, what other little boys may not know yet, because they have parents that do all that stuff for them. And so that's another thing under the mom guilt that I feel. But without my children, I would literally have no purpose. They give me purpose every single day, and I thank God for them. And I'm sorry for the burdens that they have to face because of my disease, but God knew that I needed them. we face as a community. You know, collectively, these are the challenges and disparities that we face. And I am reading from the NCBI, uh, or the National Library of Medicine website. It's the National Library of Medicine, National Center for Biotechnology Information. Okay, so that's what NCBI stands for. All right, and so we are talking about the challenges and disparities that sickle cell, the community faces together as a collective. Sickle cell disease is an inherited blood disorder most common among African American and Hispanic American persons. The disease can cause substantial long term and costly health problems, including infections, stroke, and kidney failure, many of which can reduce life expectancy. Disparities in receiving health care among African American and other racial ethnic minorities groups in the United States are well known and directly related to poor outcomes associated with sickle cell disease. As an orphan disease, one that affects 200,000 persons nationwide, SCD does not receive the research funding and pharmaceutical investment directed to other orphan diseases. For example, cystic fibrosis affects fewer than half the number of persons, but receives 3.5 times the funding from the National Institute of Health and 440 times the funding from the national foundations. Okay, let me read that again. Okay, just in case the people in the back didn't understand what I just read. Sickle cell disease does not receive the research funding and pharmaceutical investments directed to other orphan diseases. For example, cystic fibrosis affects fewer than half the number of persons, but receives 3.5 times the funding from National Institutes of Health and 440 times the funding from national foundations. Okay? So when you can't understand why I'm so passionate about sickle cell, when you can't figure out why I insist on talking about this continuously until I'm blue in the face, this is why. Because this is what we're dealing with. Okay? And I'm going to add something to this. There is a cure, quote unquote, going around. And the cost of this so called cure is literally in the millions. So if you want to be cured of sickle cell disease, you have to be a millionaire. Literally. You have to be a millionaire to be able to afford to get cured of sickle cell disease. And if you try to join a research study, more than likely, if you're over 30, they're not going to take a second look at you. They'll be like, you already lived half your life with this disease, so you might as well finish. You might as well finish the rest of your life with it. Anyway, let me keep reading. In this review, we discuss the health inequities affecting persons with sickle cell disease, describe programs intended to improve their care, and identify actions that could be taken to further reduce these inequities, improve care, control treatment costs, and ease the burden of disease. Okay? So, this is what they are setting out to do in this um, case study or in this research. Sickle cell disease affects about 100,000 people in the United States. The disease causes red blood cells to lose their normal disc shape and become sickle shaped and rigid. These sickle shaped cells adhere to vascular walls, impede blood flow and oxygenation, and cause episodes of intense pain and other complications that affect multiple organ systems. Persons living with sickle cell disease often have chronic kidney disease, stroke, and liver and lung complications. The lifespan of those with the most severe form of sickle cell is on average 30 years shorter than for the general U.S. population. Although approximately 90% of persons with a diagnosis of SCD in the United States are African American, the disease also occurs among Hispanic American persons and persons of Mediterranean, Middle Eastern, and Indian descent. Okay, and here is a depiction of the areas of where sickle cell affects, the most in the United States. So, figure 1, it says estimated number of persons with sickle cell disease based on state specific African American and Hispanic birth cohort disease prevalence and 2008 U.S. Census population corrected for early mortality. Map previously published by Hassel and reprinted with permission from the American College of Preventive Medicine. And in figure B, the number of sickle cell disease treatment centers per state. And this is 2017 data source, Centers for Disease Control and Prevention. Okay, so this is where these figures are coming from. All right. As an orphan disease, one that affects 200,000 persons nationwide, sickle cell disease does not receive the research funding and pharmaceutical investment given to diseases that have a higher public profile or that have captured the attention of medical research and funding communities. As such, persons living with sickle cell disease usually have less access to comprehensive care and more difficulty in obtaining medications for pain relief than do persons with other chronic diseases. Most persons living with sickle cell disease are publicly insured, and Medicaid recipients with the disease have substantial barriers to receiving necessary services. Despite the low prevalence of sickle cell disease, the cost associated with managing the disease is high, and the disease has long term complications. Healthcare providers with expertise in the treatment of sickle cell disease are in short supply, and disease modifying treatments are limited. Here, we document disparities in healthcare access and quality care for persons living with sickle cell disease, and identify actions for reducing these disparities. Okay, and so here are some of the disparities: lack of access to healthcare and specialty care. A major challenge for persons with SCD is poor access to appropriate health care. Although hemophilia and cystic fibrosis each affect fewer than half the number of persons in the United States than does SCD, persons with these diseases benefit from more than 130 comprehensive treatment centers nationwide. These centers have multiple disciplinary teams dedicated to improving treatment centers nationwide. Oh, sorry, I read that wrong. These centers have multiple disciplinary teams dedicated to improving health outcomes, providing quality care, and reducing costs and disparities in access to care for these patients. In contrast, specialized SCD healthcare providers with comprehensive expertise are scarce, particularly in low income and rural communities with limited resources. Furthermore, in non specialized hospitals with few SCD patient populations, poor outcomes were reported, likely because of a lack of hematologists with SCD expertise. A survey of 30 pediatric SCD specializing in adults with SCD upon aging out of the pediatric care system. Oh God, I read that wrong too. A survey of 30 pediatric SCD centers found that only 18 centers routinely transitioned their patients to a hematologist specializing in adults with SCD upon aging out of the pediatric care center. I definitely understand why not all of them would age out their patients, because they understand that once that patient ages out of pediatric care, the level of care that they are going to receive is going to drop drastically. This is why they do not transition them. This is why some pediatricians will fight tooth and nail to keep their patients, because they know how bad it is for sickle cell disease adults. Okay? The children with sickle cell disease have the Cadillac of care until they turn 18 or 21 or 25, or they have a baby, or they go, well, no, I can't say go to the military because they don't allow sickle cell disease patients in the military, but still, like, they don't like to age their patients out. And I understand why. I completely understand, because the vast difference between the quality of care that I received when I was a child versus in my adulthood is scary. It's scary. It really is. Like, I have been tortured way more when I was, you know, as an adult than as a child. Like, as a child, they try to do everything they can to make you comfortable and not to inflict any more pain onto you than necessary. When you're an adult, they're like, let it rip. We're going to do all the things, we're going to do all the tests. even if they're painful, it doesn't matter. You know, we're going to put this woman through the ringer, as if my body has not already put me through the ringer enough. Okay? And this is the reality of the things that we face. This is the reality. And nobody likes to look at that reality. Nobody wants to hear about that reality, especially if it's not their reality, especially if they can't relate to it, especially if it's not something that makes them laugh or smile, especially if it's not an entertaining topic, you know, they don't want to hear it. They don't want to hear it. The only people that give a crap are the people that are directly affected by sickle cell. It's either they have it, or a family member has it, or their child has it, or their spouse has it, or they're a doctor to sickle cell disease patients. That's it. You won't find nobody else outside of our community helping us. Very few of them come to help. And if they're a pharmaceutical company, they're not coming to help. They're coming for the insurance benefits that sickle cell patients receive. That's what they're coming for. That's it. That's all. If they can't make a quick buck off of us, if they can't use us as a test dummy so that they can, you know, test all these different kind of medications on us, and then at the end of it tell everybody that their experience was great and they feel much better after the fact. Like, if you're not doing that for them, they don't want to hear it. They want nothing to do with it half of the time. If there is no direct benefit for them, they are not doing it. They're not engaging. They're not listening. It's too boring. It don't have nothing to do with them. It doesn't affect their life. And that is the sad reality that we face. And the fact that we are a majority brown and black community, that definitely doesn't help. It doesn't help our case. When we try to get these laws passed, or we try to get funding passed, or anything, for our community, they don't want to hear it if it is not benefiting them. And that is why we have to do the work ourselves. We cannot continue to sit back and allow the things that they give us to just be it, to keep allowing them to give us the bare minimum. We have to go and demand everything that we deserve. And they're not going to give it to us as long as we continue to ask nicely. We're going to have to start demanding it. And that is what this podcast is really about. It's about spreading awareness, but it's also about making sure that we can secure great things for our community as well. And I am joining in the fight, and I'm going to do everything in my power to make some real change while I have breath in my body. Okay? Before I check out of here, I want to secure great things for my community, things that will change the state of sickle cell permanently. And I know that we can achieve it. And when I figure out what that looks like tangibly, oh, you better be ready, because I'm going full throttle after that. Full throttle. And this is only the beginning. This is only a small piece of the work. This is only a small, very, very small portion of the work. More is coming. That I can promise. But I want to finish reading about the disparities that we face, and also finish off with listing the last few challenges that uh, we face in our community, and we will put a wrap on the second episode. Okay, so now moving on to poor disease outcomes. Disparities in lifespan exist between persons with SCD and the general U.S. population. The median age of death for persons with sickle cell disease is 45, 25 to 30 years younger than that of the general U.S. population. Excuse me. Survival rates for children aged 18 and younger with SC disease have improved during the past several decades. A 2010 study found that 94% of persons with SC disease survive to adulthood, an improvement from a 2004 estimated survival rate of 86% for children with SCD. However, mortality rates were higher among young adults aged 20 to 24 from 1999 to 2009 than they were during the previous 2 decades. The 2009 mortality rate for persons with SCD was 0.6 per 100,000 population among adolescents aged 15 to 19, but 1.4 per 100,000 population among young adults aged 20 to 24. Thus, mortality rates for young adults with SCD increased 3.4 fold as they transitioned from pediatric care to adult care. This increase could partially be driven by limited access to specialized care in the adult setting, but more quality improvement efforts should examine how to address this disparity. Okay, so our mortality rate increased 2.3 fold. 2.3 fold. It's very disheartening. It's very disheartening. But these are the facts, front and center. Rates of preventative care are also lower among patients with SCD than among patients with other chronic diseases. Newborn screening for SCD, which was implemented nationwide in 2006, decreased mortality among newborns and increased access to necessary specialized care. However, a survey of 39 state screening programs found that 12 programs did not follow patients' long term after SCD diagnosis. A comparison of counseling and other preventative services for adolescents at, at cystic fibrosis and SCD treatment centers found that 86% of adolescents with cystic fibrosis had received at least one immunization in the previous 2 years, whereas only 51% of adolescents with SCD had done so. Most children with SCD are not monitored for stroke risk or transcranial. Most children with SCD are not monitored for stroke risk with transcranial Doppler ultrasound. In a 2015 study of 4,887 children aged 2 to 16 years with SCD, the annual rate of transcranial screening varied considerably among states, from 7% in Texas to 54% in South Carolina. Finally, among 2,821 children aged 3 months to 5 years with SCD, only 18%, range 6% to 27%, received a recommended 300 or more days of antibiotic prophylaxis, and more than 25% had no documentation of having received recommended pneumococcal vaccinations. Without these services, children with SCD are at a greater risk of death and cognitive defects from infection and stroke than children with SCD receiving routine screening and preventative treatment. So even for our babies, even for the sickle cell disease babies, they're dropping the ball. Depending on where you are born, which no child has any control over, your mortality rate will vary because the services that are not available in your state, you don't even know about. So I'm sure there's some sickle cell disease kids out there that just go to the doctor once a year like normal children, you know? And that's all well and dandy if they're healthy for the most part when they're young. But if they're not, in some states, they will not even be able to find adequate care at all, which will basically push them unnecessarily into the ER and urgent cares where they cannot even really be helped fully. The only thing that they can help you do in the ER is reduce the pain. That's it. They cannot help you with any sort of long-term care. They cannot help you with figuring out where to go to get better services. Like, they can't refer you to a hematologist. The best that they could do is probably print up a list of the closest doctors in your area. So we are being left out at every single turn. And it's right here in black and white. Right here, they are telling you how they are leaving us out of the conversation. If you made it to the end of this episode, I want to first say thank you for your support. Thank you for listening to this podcast. And I would also like your comments and critiques about this episode in the comments below. In 2 weeks, I will be releasing the third episode of the My Sickle Cell Life podcast. So stay tuned for that. And until then, thank you for coming out. God bless you and have a great one. Again, thank you for listening to the My Sickle Cell Life podcast.